Did you know every 2 minutes, another American man is diagnosed with prostate cancer? And if you're over 50, that risk is rising every single day, even if you don't have any symptoms at all. According to the American Cancer Society, in 2023 alone, more than 288,000 new cases of prostate cancer were detected, and nearly 60% of them were diagnosed at a late stage. A study from Johns Hopkins found that a sedentary lifestyle, a diet high in unhealthy fats, and poor daily habits after age 50 are 3 key factors that rapidly increase the risk of developing this disease. Prostate cancer is a slow-growing yet silent type of cancer. There's no pain, no visible blood, no clear symptoms, until the cancer has already spread beyond the prostate. And at that point, you may be forced to undergo chemotherapy, radiation, or full surgical removal. The scary truth is this: most of these cases are preventable with just a few simple lifestyle changes. Richard Morgan, 58 years old, was once a factory supervisor in Texas. He worked 10-hour days, barely moved, and ate whatever was quick: grilled meats, fries, and sugary sodas. At night, he often stayed up late, avoided exercise, and ignored his frequent nighttime urination, assuming it was just part of aging. It wasn't until one morning, when he noticed blood in his urine and pain in his lower back, that he finally saw a doctor. The diagnosis: stage 2 prostate cancer. It hit him like a lightning bolt. Fortunately, it was caught early. After treatment and recovery, his doctor warned him, without a lifestyle overhaul, the cancer might return. From that point on, Richard committed to change. He adopted a Mediterranean diet, eliminated red meat, started walking every morning, quit smoking, and scheduled yearly PSA screenings. Within 6 months, he lost 20 pounds, slept better, and his test results showed his prostate was stable again. Today, Richard shares his story openly at community health meetings with one clear message: if I had made these changes earlier, I might have saved myself from a year of living in fear. In this video, 50+ Health Guardian will reveal 6 science-backed habits proven to significantly lower your risk of prostate cancer. These habits are supported by studies from Harvard University, the Mayo Clinic, and the National Cancer Institute. We'll help you identify the common mistakes most men over 50 are making every day and how to fix them before it's too late. And you'll want to stay until part 3, where we expose one surprisingly harmful habit that over 80% of men over 50 do every morning, thinking it's healthy. But in fact, it quietly fuels cancer growth. Don't forget to subscribe to 50+ Health Guardian for more life-saving content to protect your prostate health, heart, and overall male vitality after 50. Let's begin with the first habit, a simple shift that could very well save your life. Habit number 1. Follow a plant-based diet. The food you eat every day is either silently nourishing or poisoning your prostate. And if you're still consuming large amounts of red meat, fast food, greasy meals, and refined sugars, it's time to take a serious look at your plate. Because what you eat today may determine whether you become one of the men diagnosed with prostate cancer in the next few years. A 2022 study published in the Journal of Urology tracked over 47,000 middle-aged men over a 10-year period. The findings were clear. Men who followed a plant-based diet, especially the Mediterranean or DASH diets, had up to 35% lower risk of developing prostate cancer compared to those who consumed high amounts of red meat and saturated fat. Why? Is it so effective? A plant-based diet emphasizes leafy greens, fruits, whole grains, legumes, and healthy fats from sources like fish and olive oil. These foods reduce inflammation, boost antioxidant levels, and most importantly, slow the growth of abnormal cells in the prostate. In contrast, the Western diet, high in red meats, fried foods, processed snacks, and sugar, creates a perfect storm for chronic inflammation and cancer development. Think of each meal as a choice. You can put something on your plate that ages your prostate, or something that helps it heal and protects it from cancer. If you want to start today, don't overcomplicate it. Just try swapping red meat for salmon, mackerel, or skinless chicken, doubling your portion of leafy greens at dinner, using olive oil instead of butter or animal fat for cooking, replacing dessert with fresh fruit, and once or twice a week, go fully plant-based. Lentils, quinoa, steamed vegetables, and sesame oil. You don't have to become a vegetarian, but you do need to prioritize plant-based foods every day. This diet doesn't just protect your prostate, it also improves heart health, regulates blood sugar, and preserves male vitality in midlife. Remember, your prostate doesn't need grand gestures. It just needs you to eat right, consistently, and if you make the change early, you could prevent a disease that hundreds of thousands of men wish they had acted on sooner. Habit number 2, exercise regularly. You might not expect it, but just sitting too long every day can significantly speed up the growth of prostate cancer cells. A major study from the University of California found that men with low physical activity had a 31% higher risk of developing prostate cancer compared to those who exercised at least 30 minutes daily. And for men over 50, the risk increases further if they sit more than 6 hours a day without breaks. Why does this happen? Because when you move your body, you trigger the release of natural anti-inflammatory compounds. This reduces uncontrolled growth hormones, which are known to fuel tumor development in the prostate. Exercise also strengthens your immune system, improves blood flow, regulates hormones, and helps keep your weight in check, all essential for prostate health. On the flip side, a sedentary lifestyle leads to visceral fat buildup, insulin resistance, and full-body inflammation, 3 ideal conditions for cancer to grow aggressively. And here's something critical. Obese men not only face a higher risk of prostate cancer, but they also experience faster disease progression, greater spread, and more difficulty with treatment outcomes. So how much exercise is enough? You don't need to run marathons. You don't need to spend 2 hours a day in the gym. All it takes is 30 to 45 minutes of moderate activity daily. Brisk walking, light cycling, swimming, or yoga are all effective. Add 1-2 light strength training sessions each week, such as lifting small weights, push-ups, or resistance bands, and your results will double. It's not about intensity. It's about consistency. Make movement a part of your daily routine, like brushing your teeth or having breakfast. Even a 10-minute walk after dinner is far better than spending the entire evening sitting on the couch watching TV. The more you move, the stronger your prostate becomes. The longer you delay, the higher your risk grows. Don't wait until your doctor prescribes rehab after surgery. Act now while you're still healthy. Your prostate and your life need you to move every single day. Habit number 3, reduce saturated fats. Here's a truth the food industry doesn't want you to know. Saturated fat from red meat, dairy butter, and fast food doesn't just lead to weight gain. It can actually feed the growth of prostate cancer cells. A study from Harvard Medical School, published in the Journal of Clinical Oncology, found that men who consumed high amounts of saturated fat had double the risk of prostate cancer recurrence after treatment compared to those who consumed less. Even more alarming, their risk of dying from prostate cancer was up to 3 times higher. The problem is, many American men over 50 are unknowingly consuming dangerous levels of saturated fat every single day. That juicy steak at dinner, that thick slice of cheese on your sandwich, that glass of whole milk in the morning. Each one may seem harmless, but over time, they create a highly inflammatory internal environment, one that makes cells more prone to mutation and cancer. Meanwhile, the aging male body processes fat less efficiently, meaning that excess fat gets stored faster, deeper, and with more harm, especially in the prostate, liver, and heart. So how can you realistically cut down on bad fats? It's simple. Limit red meat to no more than twice a week. Choose chicken, fish, or tofu instead. Swap animal-based butter with olive oil or canola oil. Replace whole milk with low-fat or unsweetened plant-based alternatives. Avoid deep frying. Try steaming, boiling, or baking instead. And when eating out, ask how your food is prepared. Many healthy-sounding dishes are still deep-fried in saturated oils. In addition, you should increase your intake of healthy, unsaturated fats from salmon, walnuts, flax seeds, and avocados. These don't just fight inflammation. They support hormone balance and lower prostate cancer risk. Your body deserves clean, protective fuel, not hidden toxins in the form of saturated fat. And your prostate can't cry for help. It just suffers silently every time you make the wrong choice with your fork. So eat smarter, because that's how you take control of your long-term health, one bite at a time. Habit number 4. Cut back on sugar. Sugar doesn't just cause cavities or diabetes. It may be a silent accelerant for prostate cancer. You might be surprised, but a study published in Cancer Epidemiology, Biomarkers and Prevention showed that men who consume high levels of refined sugars, especially from soft drinks, candy, and processed carbs, had a 38% higher risk of developing prostate cancer than those who consumed less. Why is that? When you ingest too much sugar, your pancreas releases insulin to process it. Over time, chronically high blood sugar levels lead to insulin resistance, a condition closely tied to chronic inflammation and a biological environment that allows cancer cells to thrive. But that's not all. Sugar also fuels rapid weight gain, especially belly fat, which produces pro-inflammatory cytokines that attack your immune system and reproductive organs. And many men over 50 are living in a state of low-grade chronic inflammation, without knowing it, just because of one soda a day or a handful of cookies at night. The issue isn't just the type of sugar, it's the frequency and volume, so how can you control it? Step 1. Read nutrition labels carefully. Many low-fat products are loaded with sugar to compensate for flavor. Avoid sugary drinks, sodas, energy drinks, and even packaged fruit juices. Choose whole grains over white bread or refined pasta. When you crave sweets, reach for whole fruits, especially low-sugar ones like blueberries, strawberries, and kiwi. And don't let sugar creep into every cup of coffee or dipping sauce. It's the little by little that causes the most long-term harm. Sugar is a double-edged sword. It's addictive, it's sneaky, but its damage, especially after age 50, is very real. Control it before it controls you, because no one wants to wake up one day and hear a doctor say, "You have prostate cancer, and it might have been prevented if only you'd cut back on sugar earlier." Habit number 5. Quit smoking. If you're still smoking, even just a few cigarettes a day, your prostate is quietly suffering more than you realize. Many people think smoking only harms the lungs, but science has proven otherwise. Smoking is strongly associated with higher recurrence and mortality rates in prostate cancer patients. A large-scale study from the Harvard School of Public Health, which tracked over 5,000 men over 10 years, revealed a sobering fact. Men who smoked at the time of their prostate cancer diagnosis were 61% more likely to die from the disease than non-smokers. Their cancer was also twice as likely to progress and metastasize. The reason is simple. Each cigarette contains over 70 known carcinogens, many of which directly damage the DNA of prostate cells. These toxins create persistent, microscopic mutations that make the cells harder to repair and more prone to becoming cancerous. Smoking also reduces blood flow to the pelvic region, weakens the local immune response, and prevents micro-damage from healing properly. And here's the worst part. Even if you've already been treated for prostate cancer, continuing to smoke triples your risk of recurrence. So if you're thinking, I only smoke a few a day, or I've been smoking for decades, what's the point of quitting now? Here's your answer. The sooner you quit, the better your body can recover. Just 1 year after quitting, your risk of heart disease drops significantly. And after 5 years, your risk of prostate cancer recurrence drops nearly to the level of someone who never smoked. You don't have to do it alone. Seek support from your doctor, your family, nicotine replacement therapies, or support groups. Every small step you take today becomes a giant leap for your long-term health. Your prostate doesn't have a filter like your lungs. It simply absorbs the damage, quietly, relentlessly, with every puff you take. Quitting smoking isn't just a bold decision. It's a life-saving one. Habit number 6. Get regular screenings. Prostate cancer is one of the few cancers that can be detected early if you're proactive about screening. But unfortunately, millions of men over 50 still choose to wait until symptoms show up. And that's a choice many come to regret. Here's what you need to hear. In its early stages, prostate cancer shows almost no symptoms. No pain, no fatigue, no obvious physical changes, and it's that silence that makes it so dangerous. According to the National Cancer Institute, nearly 90% of prostate cancer cases can be treated successfully if detected early. But once the disease spreads beyond the prostate, the 5-year survival rate drops below 30%. You can prevent that with just one simple screening each year. There are 2 key tests: a PSA blood test, prostate-specific antigen, which can detect abnormalities long before symptoms appear. A digital rectal exam, DRE, allowing your doctor to assess the size and firmness of your prostate. If you're over 50 or over 45 with a family history, you should start annual screening immediately and pay close attention to the following warning signs: weak urine flow or trouble urinating, feeling like you can't fully empty your bladder, frequent nighttime urination, pain or burning. When urinating, blood in your urine or semen, persistent discomfort or dull pain in your pelvic area, hips, or lower back. Many men dismiss these symptoms, thinking, it's just aging. But by the time they get checked, the cancer may already be in stage 3 or 4, and by then, the treatment options become more limited. Don't let screening become something you meant to do, but never did in time. Just one blood test. Just a few minutes with your doctor. But in return, you gain control over a disease that threatens millions of men each year. Think of your screening as regular maintenance for the most valuable vehicle you'll ever own: your body and your prostate. Though small, deserves the right attention, at the right time, in the right way. Conclusion. You've just explored 6 proven lifestyle habits with 50-plus Health Guardian that can naturally and effectively reduce your risk of prostate cancer. There is no magic pill, no guaranteed cure once it's too late. But you can control your daily lifestyle choices. Let's review what you've learned. You can protect your prostate by eating smarter, moving more, cutting back on saturated fat and sugar, quitting smoking, and getting screened regularly. Even when you feel perfectly fine, each of those actions, though small, could be what saves your life, and not just survival. We're talking about living well, with purpose, energy, and vitality. Through your 50s, 60s, 70s, and beyond, prostate cancer is a silent race, and the winners are those who act before the warning signs show up, not after. If you found value in this video, share it with friends, co-workers, and loved ones. Anyone over 50 who may need to hear this message. You could be the reason someone detects their cancer early or never develops it at all. And don't forget to subscribe to 50-plus Health Guardian today. We're here to bring you real, science-backed, and timely insights to help you live stronger, smarter, and longer after. 50, see you in the next video. Welcome to 50 Plus Health Guardian, where you don't just live longer, but live better.